county level versus county allocation of funds and commitment towards their own county's healthcare. Isn't that part of the problem of this washing things up to the Kenyatta National Hospital?
Yeah.
Address that, because a lot of your strikes as a union also seem to come from this problem at the county level.
They don't have capacity to plan for their human resources, plan for their supply and commodities. That means that they always get stockouts in essential medicines. And three, because of also not knowing what to do with it, they like throwing things at Mwananchi, so they buy 70 ambulances that are just matatus to ferry patients. Sometimes they go to Red Cross to give them ambulances, and they spend I don't know whether it's 900,000 per ambulance.
Stop!
Per
I'm really
anyway,
curious by this word, capacity. Capacity is what? Capacity is that they don't know what to do, or they refuse to find out what to do.
It's three. They don't know what to do. They refuse to find what to do, and they're not interested in being told what to do.
Well, that then is a little bit more of a problem of than not just having the capacity to do something. It is not having the will.
Of course.
And this sits squarely at county government level.
Exactly. So that's the first problem, that issue of capacity. The second problem is corruption. So 14% of our public funds that go into county for health specifically go into private pockets. So 14% of all of this money is 14% are the national government. I'm mixed up. 29% of the county government.
Let's double it.
So Ministry of Health budget, 14% is stolen. County governments, 29% is stolen. And then it's broken down into simple things like they always create emergency stockouts, so they have to respond to this particular disease, and those are deliberate. So that lack of capacity also is also deliberate to feed into the corruption. Counties are a big mess because the governors get funding, and they get funding from business people, and these business people come in the name of PPPs, and that's the political interference. Then with the corruption and then the lack of capacity, then we are in the system that we are. How do you get away from that? One way to get away from that is to define a model of health sector that we want. We believe, and we want to hope, and we are very optimistic that with the president saying we need universal health coverage, we can ride on that. And for us as a doctors union, I think this is one of the moments we said we have been waiting for, and we believe that there's a big opportunity. There's even a big opportunity with all this mess at Kenyatta National Hospital to say it's time now to fix,
to draw the line,
line. And we want to draw the president's attention and say, wait a minute, we want to help you achieve this, because doing what he's saying will take more courage than saying it.
Unpacking all of the interests and getting this all aligned in a way that serves patients, who at the end of the day is who we're talking about.
Exactly.
That is going to take a lot of courage and a lot of unpopular decisions.
It's very unpopular, and I hope the president is truly tired of Harambes as we are.
How do you measure progress and service provision for patients? Is it when the patient has walked out? Is there some kind of criteria that measures the experience that a patient will have?
Length of hospital stay. Number two is how soon do you come back to hospital for the same problem that you were treated. The waiting time in hospitals, waiting time before you get care. So that's also part of what they call value-based patient outcomes. So if you are going to hospital because of headache, and you have to return to hospital because unless you've been told that this is something that you will need regular clinics, if you're coming back within 3-6 months, then it means that your problem was not sorted. So not sorted means that it was either not correctly diagnosed, or if it was correctly diagnosed, not correctly treated. Okay, or then you have a different problem. So and those are some of the ways to measure quality. The way to solve the county problems is what the president's already done by saying we want universal health coverage. So you as a county, with all your problems, with all your interests, with all those things, please fit into
Figure
this
it out.
agenda.
Figure it out yourself.
But you will fit into this agenda. Yeah. What I want at the end of the day is that every single
want the
penny-
result.
I want the results. And I think if he is serious about it, we will help him do it.
I think, Mr. President, if you and Cabinet Secretary for Health, Directors of Medical Services, CECs at various counties, county governors are listening, we have a real opportunity here and now to completely overhaul our public health care system so it works for us. So we're not being called to Harambes. So we're not watching our loved ones dying from illnesses, ailments, and injuries that they need not die for. Or we're not one illness away from being absolutely broke and having to start from scratch. But I guess it's up to you if you're watching, and of course up to us to keep asking these questions that will fix the public healthcare system in Kenya once and for all, and perhaps even make us a model around the world. Thank you for watching Focus. My name is Renee Gavau, and thank you very much to
you.
Dr. Aluga.
Thank you very much.